Good day, my dear students. I hope you're doing fine and always remember that everything will pass through. By the way, I am your teacher Angel, your teacher for today's discussion. Today I'm going to discuss the content of the that research about society and technology, science and technology and society, which is entitled Technology Studies to Meet the Needs of the People with Dementia and Their Caregivers. So this study is really helpful to the people with dementia and the caregivers. It is written by Paibul Tupu. So there are three studies that related in science and technology and society, which is according to my research. But today I'm just going to discuss one study for today. So here are the content of the research, which I am going to dig deeper in the next slide. So first one is the rationale. So technology has been identified as one tool that can be used to improve independent living and improve the safety and autonomy of people with dementia and support the quality of life such as people and their family carers. So technology is really useful to everyone, especially with dementia, and this study is aimed to focus on the technology that can be helpful to the people with dementia. And as Hajin 2004 stated, that proposed that when assessing the use and usefulness and assistive technology for people with dementia, at least 5 aspects should be taken into account. The first aspect is the impact of technology. Second one is the impact of personal characteristic. The third one is the impact of family carers. The fourth one is the impact of the environment, and the last one is the impact of research process and researchers. The next part of the research is the background of the study. So, as you can see, the aim of this article is to present a review of previous study on technology and dementia published between 1992 and February 2007. So this study is a meta-synthesis study which they collected a article from January 1992 and February 2007, which is related to technology to people with dementia. And the analysis focused on technology use, the study design, methods, participants, outcomes, variables, results, and the main conclusion. So what are the methods used in this study? So the researcher of this study used a different databases to collect data, which I mentioned in this slide, and they also used a keyword to find an article, which is also stated in the slide, and finally the total of 66 studies that they analyzed, and they are all published in peer-reviewed journals. So the important part of the research, this article, is the result and conclusion. So according to the result and conclusion of this study is the result shows that the number of studies done in technology and dementia are limited compared to other fields of dementia research, particularly the clinical trial and anti-dementia drugs. And also, the result shows that computer and telephone mediated services were widely accepted by the family carriers, although the usefulness varied. So there in this study, in the result part, they able to show the different technology that can be useful, and there how technology helps the dementia. And the most again, there are three conclusions of this study made. First conclusion is the national and international multidisciplinary research program are need to improve the knowledge of the possibilities and limitation of technology in supporting people with dementia, their family caregivers, and formal caregivers. The second conclusion is technology can already be successful used for supporting people with different stages of dementia and their family careers, but it requires assessment of their needs. And the last one, no conclusion can be drawn about the cost effectiveness of the use of technology at the moment. So, what is the contribution of the study to the body of knowledge? So, we all know that technology is useful to everybody, especially with people with Alzheimer's disease and other dementia. And technology make life with dementia less difficult. Through this research, the family carers and the caregiver will have the basis on what are the technology that could help them with the people with dementia. As you go deeper with the study, you will know that there are different technology that could really help them, as if they really wanted to learn from them, and they're really helpful. And they also give some conclusion and recommendation on how effective they can be used. So that's how this study really important to the body of knowledge. So that's all for today, my dear students. I hope you learned something from our discussion. For our next discussion, I'm going to discuss the other studies that I mentioned in our first slide of this video. And thank you so much for listening. See you again and have a nice day. Keep safe, everyone. Bye-bye.